Hi, Dr. Scott Fuller here. I'm going to do COVID numbers, are they accurate? This is part 3. So if you didn't catch part 1 and part 2, you can go to my YouTube page and listen to those shows. Why do I want to pay attention to the numbers? So I don't think the numbers that we're seeing are accurate, and it is important. Stick with me for a moment and let's talk about this. So the coronavirus numbers, here we are, January 5th of 2021. And if you look today, this just the United States numbers now, 363,000 deaths from COVID-19. So let's wrap that into, and these are very morbid numbers, and I'm going to be talking about deaths, and let's just keep in mind that when it's these big numbers and so forth, every life is precious, and I fully understand that. We just have to talk about these things to have something to talk about. So U.S. deaths per year. Each year, you can go to the CDC or other organizations and look up how many people pass away in the United States. And if you look at 2018, so the numbers are tabulated in 2018, there were 2,800,000 deaths on a round figure in the United States. 2.8 million. Out of that, number one cause of death would be heart disease, heart attacks at 655,000. Cancer is 599,000. Accidents are 167,000, strokes 147,000, Alzheimer's 122,000, diabetes 84,000, and so forth. So when you add all those numbers up in the causes of death, you're at 2.8 million, and that was in 2018. So 2020, let's assume that over time, the number of deaths in the United States will slowly climb over time because the population just gets larger all the time, okay? So that number is going to just, if you regraphed it out, it would be a slow increase like so. If it's true that there's 363,000 to 350,000 deaths in 2020 from COVID-19, when we look at that graph and we look at the 2020 numbers when they come in, there's going to be a huge spike like this. It's literally going to look like that, okay? If it's true that we're talking about here. So if there's about 2.8 million people that will pass away, there should be an additional 350,000 coronavirus deaths in 2020 when the numbers are all finished, which would be about a 13% increase in the number of people that pass away overall in the United States, a massive spike. So I'm prepared to be wrong. I'm ready to be wrong. And if I am wrong, I'm fine. I'll come on here and say, you know what, I was wrong, and I'll tell you the reasons, and maybe these are good things that I'm wrong. But we should see a spike. I don't think we're going to quite see that spike. And let's assume that in 2020, there's going to be a similar amount of heart attacks and heart disease deaths and strokes and diabetes and Alzheimer's and cancer. As a matter of fact, you could probably make with Corona jail, as I call it, everybody's stuck at home. Just talked to somebody prior to the show. I've been eating worse and eating more, and people were getting less exercise and outdoors less. Plus, you could say as a populace overall, we had more stress because there was economic stress and staying at home stress and unsureties about the economy and so forth. If you add stress, you should probably actually see an increase in those heart disease and cancers and strokes and diabetes and so forth, because stress would cause an increase in all of those. So we should see even a bigger spike on the number of deaths. So we'll wait and see if that ends up being the case. The second thing I wanted to mention about not trusting the numbers is, I did this on the prior Can We Trust the Numbers shows, and I want to revisit this again because there's just a little bit more data that I wanted to let you know about this. And as I talk about this on reclassification of people when they die and what they're putting on death certificates in hospitals, please know that I'm not dishing out blame here. I'm not blaming the HHS governmental agency. I'm not blaming hospitals and hospital administrators, not doing that at all, or doctors or whoever might be signing off on these things. There are various motivations and factors involved that would result in making changes in these certificates and causes of death and so on and so forth, okay? And I think it's also part of this is what happened is the law of unintended consequences, okay? So here we are, early in 2020, COVID-19 hits. we didn't know if it was going to be the zombie apocalypse or mass extinction event in the beginning. So a lot of these precautions were taken. We realized, okay, there could be a huge surge in hospital needs, nurses and doctors and support staff and EMTs and everybody else involved in hospital situations. Emergency room beds and incubation and so on and so forth. So we needed to clear that out. A lot of hospitals had canceled all of their elective stuff, so their income plummeted, right? The HHS said, we understand that the whole system is in trouble. We need to keep you open just for all of these purposes to care for people. We're going to reimburse you more if you have a COVID case. Follow? Because that COVID case is taking up more expense, more staff, more time, the expensive beds and all the materials, plus your income is way down from all the other stuff that is being canceled. We're going to reimburse you more. If somebody was in the hospital for an emergency thing and passed away from whatever it might be, the heart attacks and strokes and cancer and so forth, you would get a Medicare amount of reimbursement, which was X. But HHS says, we're going to reimburse you more, we're going to give you Y. Follow? So if somebody passed away and it was a non-confirmed COVID death, they might have been put on their certificate as COVID. And that makes sense from a hospital administrator standpoint and the hospital standpoint to increase the income. And HHS is fine because we just got to dump money in the system and keep the system going. But now we have that. And I said on the prior shows that I have direct information of people that said our parent, our grandparent, a person died in the hospital. We knew it was Alzheimer's, we knew it was stroke, we knew it was cancer, but we got the death certificate back and it said COVID, and we were kind of wondering about that. Not necessarily that they took any action, but they just were wondering why that was the case. So that's just a small sample set, but I've had other people, as I've been talking about these things over the past several months, tell me, yeah, I have this scenario, or I did see that, and yeah, I have actually had a couple of hospital administrators admit that we do that, and so forth. Okay. I had an idea to straighten that out. Now, why is it important to talk about the numbers on point number one, that if it's true, we should see this huge spike, and point number two, that the law of unintended consequences might be that people didn't really pass away with COVID, but they were listed as such because of this reimbursement scenario that was going on. So why is this important? Does anybody really care? Because we just need to push along, save lives, help each other, and do all these great things. It's because everybody said we have to pay attention to the science. You can't be in the denial camp or the catastrophe camp, apocalypse camp. Camp denial, camp apocalypse, as Dr. Zubin Damania, he listed it that way in one of his videos. I thought it was really interesting. You're either in camp denial or camp apocalypse, right? So when you find that middle ground here, and we're just trying to help each other and get through this and so forth, everybody says we need to pay attention to the scientists and the scientific numbers, but if we're basing it on bad numbers, we are creating public policy that affects us all that can be extremely detrimental. And Dr. Zubin Damania, when he was interviewing Paul Offit and others, they were talking about the demise of people from these massive shutdowns, which might not be appropriate in all cases. So we're shutting down schools. But as he was talking about on his show, Dr. Zubin Damania, and you can find him on ZDoggMD, and I'll have some links for you as well, is he was talking about that school children age are not important vectors of transmitting COVID-19 in particular. He said they are massive incubators of influenza, seasonal influenza, but not with COVID-19. We need to look at the numbers, he says. So he made the argument, let's get the grade kids back to school. Now, a lot of people are saying, well, what about the teachers? And people were getting sick, and the teachers were getting sick, and kids were getting sick, and so on and so forth. He said it's not easy. But he also was suggesting that maybe it's community infection that was being brought into the schools, let's say with the adults. And other people have said in the school systems it's more from adult to adult transmission than the kids giving it to the adults and making other people sick on the outside. So, because you look at all of the taxing of families and humans and communities by closing schools. And then you look at all the businesses that come down and the economic turmoil that is happening, which affects the poor even more. Then you've got more stress, you have more drug abuse, you have more alcoholism, you have more substance abuse, you have more domestic violence, you have more of all these economic downturns and things that affect, again, the lower class more than others. And then you start measuring all of those people that literally, they said blatantly, that can die from basing all of these structures of how we're handling ourselves as a society from these numbers. So if the numbers are high, we might overreact and do these things. And Dr. Zubin, Damania, and we'll talk about this in other shows as well, he's saying, like, why are we mandating masks to people hiking outside in California? There's virtually no transmission if people were not wearing masks and they passed 5 feet from one another when they're outside. Or why did he made the suggestion, why are we closing down outdoor dining? Again, the transmission there, you're outdoors with great air transfer and materials being carried away much, much more readily than a closed environment. He says, why are we doing that? So that's why I've harped on this and done shows on this, is the numbers need to be accurate, and I don't think they are. There's suggestions here that might be a bit different. How different? Well, again, I went to the American Hospital Association. There are 6,100 hospitals in the United States, 6,100. Now, not all of those hospitals are dealing with COVID-19 patients or have emergency rooms or intensive care units and so on and so forth. So I just picked a number. I said, well, what if there are 2,500 hospitals that are dealing with COVID-19 around the country? And what if only 10 records or 10 death certificates were really not COVID, actually were listed as COVID? That's 25,000 people right there that were misclassified. What if it's 20 death certificates per hospital of 2,500? That's 50,000 people in a blink of an eye all of a sudden were misclassified, and it adds to the social disruption, it adds to the fear factor. Never mind that, there's that huge fear factor. And if you have fear factor, you add to stress, and if you have stress, that's not going to affect our immune systems in a positive way, in a very negative way. And then we become more susceptible to all infections and all other causes of death that I talked about as well. I also mentioned a way of correcting that. I talked about having anonymous call-ins with no penalties to hospitals if they would straighten those numbers out, but then there's no motivation for a hospital administrator to take the time to go ahead and do that. And then I thought about, well, maybe we could incentivize them that there would be an equal playing field, whether it be a Medicare patient or a COVID patient would get equal pay, equal reimbursement moving forward. But that won't necessarily change the numbers in the past, so we're still left with that big number. So I really don't have it figured out. My conclusion to all of this is we're probably never going to know the real numbers because of all of those factors that I just said. I also had reported in the past that the CDC stopped counting the seasonal flu in about April of 2020, and I thought that was a bad idea because, again, those seasonal flu people might be classified as a COVID-19. And remember, a lot of news reports are always talking about confirmed or suspected cases of COVID-19, and that doesn't sound very scientific to me. We want to know confirmed, not just suspected. Of course, the testing is better now, but it wasn't necessarily nearly as good in the beginning. I've talked about these numbers in the past. In 2017 to 2018, just in the seasonal flu season during that year, just in the United States, 45 million people were sickened, much more than COVID-19. 21 million had medical visits, pretty good strain on the medical care system, with 810,000 hospitalizations for seasonal flu in 2017 to 2018, and 80,000 deaths. So nobody heard about it, we didn't blink an eye. I'm not saying that COVID-19 is not worse than that, it looks like it is. But to go from nothing to just destruction of the economy and so on and so forth, we need to just visit that as a population. Just a couple resources while we wrap up here. I did mention Dr. Zubin, Damania, and he goes by ZDoggMD, and that's his website. He has a great YouTube page. He's a medical physician, and he's had serious people on his program. As I said, he interviewed Paul Offit. So if you go to his YouTube page, watch his December 4th interview with Paul Offit. In there, they covered a lot of ground, and they were talking about the vaccinations. They talked about some of the issues that I mentioned in here. And they also mentioned the vaccine, and they both agreed that the vaccine is a good idea, and the numbers look good initially. Again, this is December 4th, so this is a month ago, prior to it being rolled out. And Dr. Damania asked Dr. Offit, do you think that the vaccine should be mandatory? And Dr. Offit said, no, I don't think it should. And he said, we need to be humble here, as I'm trying to remember the quotes, because I've listened to this a few times. We need to be humble. The research was on a smaller group. When we unleash this onto, and I'm paraphrasing here now, unleash it to a bigger group of people, there might be some complications that we haven't recognized yet. So making it mandatory without that data is not a good idea. And Dr. Zubin Damania pretty much agreed. He said, this is a little bit of the libertarian coming out on me and saying that I don't think it should be mandatory either. I would encourage that. I think it's a good idea, but he also said it shouldn't be mandatory. He was suggesting that people should do their own evaluation of themselves and say, should I get this or should I not get this? If I am a 20-year-old and I'm super healthy and I don't have any comorbidities and so forth, and do I want to have that risk? Dr. Damania himself said, well, I'm in my late 40s and I have a clotting disorder and I sometimes work in a hospital and I'm at a higher risk. I might choose to have the vaccine. So that was an interesting video. Dr. John McDougall, medical physician, drmcdougall.com is his website. He's done several videos on COVID. A couple of very important things that I wanted to mention to you. He believes in vaccination. He says, my family's vaccinated, my grandkids are vaccinated, but I don't recommend the flu vaccine. And he says, right now, I don't recommend the COVID-19 vaccine. He says, the seasonal flu vaccine, just the numbers don't work, the research isn't there, I don't recommend it for his family and his patients. And he's an MD that says, I believe in vaccination, but not that. So that was interesting, that was his spin on that, so that's just information for you to take a look at. Zach Bush MD, zachbushmd.com. I've mentioned him before. He gives interesting things about improving your immune system naturally, which is something that combats all of this. And that's what I wanted to wrap up with this. Regardless of all these numbers and money and economy and so on and so forth, the best defenses are things that many doctors have been talking about, including Dr. Anthony Fauci, who says the 3 most powerful ways to increase your immune system are free, and they are eat a healthy diet, get enough regular sleep, reduce your stress. Don't forget that Dr. Anthony Fauci takes 6,000 international units of vitamin D per day and 1,000 milligrams of vitamin C per day. And imagine here, as I've said in other shows, if we added in regular exercise and chiropractic care, taking care of your spine and immune system, breathing exercise, you do all these things, yoga, meditation, mindfulness, you add that together as a populace. We need to visit these things now. Look at all these people with comorbidities that are being adversely affected by COVID-19, and if we improve these health strategies, even if we get exposed, we're going to be able to handle it a lot better. Dr. Fauci and all these other doctors are saying if you are going to get exposed and you have comorbidities, your chance of more severe disease or death goes up. So all of us can take action right now, make ourselves healthier, and get through this together. I'm Dr. Scott Fuller. Thank you.